Hello, my name's Penny Meadows, speaking on behalf of the Thurrock CCG and St Luke's Hospice around a new project I'm leading on called It's Time to Talk. I hope to host a series of podcasts focusing on access to end-of-life care services for people with a learning disability, raising the profile of their needs and helping their families. Our aim and passion is to improve the quality of support and access to palliative and end-of-life care services. Here at St Luke's Hospice, we are a charity providing compassionate care to people whose illnesses are no longer curable. We promote dignity in dying and empowering people to make choices they want from the moment they are diagnosed. For more information, just give us a call on 01268 524 973 or visit our website on www.stlukeshospice.com. Today's podcast is with Jean Kendall. Hello, Jean.
Hello, Penny. Hi. I'm a specialist health nurse working for adults with learning disabilities for Essex Partnership University NHS Foundation Trust, and I cover the Thurrock area.
Can you explain a little about your role, please?
Yes, my main role is to support adults with learning disabilities to have equal access to mainstream services, thus improving and maintaining a person's physical and mental health and their social well-being by helping to reduce barriers and encourage the person with learning disabilities to live an independent life.
Have you had any experience of working with the hospice before?
Yes, I've had several experiences working with the hospice before in relation to the care of the person with learning disabilities approaching their end of life. I'm also on the VERVE group, which is a group made up of all different organisations that encourages hard-to-reach groups to plan for their end-of-life care. At this group, where we meet at St Luke's, we share ideas and promote best practice with regards to dying matters.
Can you tell me of any experiences, good or bad, that you've had with someone with LD relating to end-of-life care?
Yes, I had a positive experience working with St Luke's where the service user was involved with the end-of-life care and treatment plan. Using a multidisciplinary team approach, effective communication, collaboration between all services and all the people involved in that person's care, ensured that their wishes were followed and respected. For example, where they chose to have their care and treatment and their funeral wishes. This promoted the person's autonomy at a difficult time and ensured that informed choices were made.
In your experience, what barriers would you say people with LD face when accessing care from services?
Simply, it is lack of communication and the person not being involved or included in key decisions and assuming that they, are being overprotected by not being told and not being prepared about their care and treatment. People with learning disabilities need to be communicated with and included in all key decisions about their care and treatment.
Would you say, from your experience with people with LD at end of life, that current services are prepared for the range of patients with LD and their families that often require additional support, help in this very difficult time?
Yes, things are improving and services are raising awareness of these issues. For example, being at this podcast today is raising awareness and bringing to the forefront some of the challenges that people with learning disabilities and their carers and families face. We also have at our trust a clinical end-of-life lead who can provide training and links with different organisations and offer support to professionals and their carers and service users. We also know that we also have a PCLD network. We also have Marie Curie and Change. They work in collaboration and produced a booklet. There's lots of publications out there. Men Dying Matters did a big publication. There's Book Beyond Words. There's lots of things being done and it's a step in the right direction.
Thank you. Health and social care staff should be aware of the need to make reasonable adjustments for LD patients to access care. How does this work in practice, and have you seen the positives this can have on the patient?
Reasonable adjustments are vital for the person with learning disabilities to ensure that the service user is central to their end-of-life treatment plan, and accessible information is provided. Easy read information is so important, and simple language should always be used. Staff awareness training days have been offered for staff to understand the needs of the service user with LD training. Flexible appointment times, I have witnessed this. The continuity of staff and the opportunity to look at good practice guidelines should be followed. There's lots of things being done. Our speech and language therapists will work with other carers and professionals to develop social stories for the adult with learning disabilities. There's life story work being offered for people with learning disabilities, and there's lots of good example practice guidelines in the gold standard publication.
Early intervention is important to avoid confusion for both the patient and their families at a difficult time, such as end-of-life care. How can we ensure this happens?
I feel to build on the future, develop and refine the services, an up-to-date register and a clear pathway is vital to services, and for people to know who to contact, inform and signpost to. And there should be support for people who are struggling with issues regarding consent and capacity.
Are there any other issues that you feel are important when supporting a person with learning disabilities facing end-of-life care?
Yes, I think the key message should be that the person with learning disabilities is central to their plan, and they have the appropriate support services required regarding advanced care planning conversations. And these are held, and the person with learning disability and the carers and families are involved in discussion re end of life, DNA and CPR. It's really important to remember that people with learning disabilities feel the same challenges as other people who are at their end of life, but they may have additional needs. Actively involving people with learning disabilities throughout their treatment will promote their autonomy and facilitate informed choice.
Thank you, Jean, for being a guest on this podcast. Thank you for everyone that has tuned in, and please look out for other podcasts. Thank you, Jean.
Thank you, Penny.